Hello, everyone, and welcome to our Facebook premiere event, Complete Care for NTM Patients. Today's event is sponsored by Insmed Incorporated. I'm your moderator, Amy Lietman, President of NTM Info and Research, and thank you for joining us today for our quick, informative discussion on the full spectrum of care that you need as an NTM patient. I'm pleased to welcome our guests for today's discussion. Dr. Kira Cohen is a specialist in pulmonary and critical care medicine at Johns Hopkins Medicine, where she co-founded and is the co-director of the Johns Hopkins Center for Non-Tuberculous Mycobacteria and Bronchiectasis. She's an expert in the care of patients with NTM pulmonary disease, bronchiectasis, and in critical care patients. And as an assistant professor of medicine, she also teaches medical students, residents, and fellows at Johns Hopkins. Dr. Chris Lippincott is an infectious disease specialist who joined Johns Hopkins, where he works alongside Dr. Cohen treating patients with NTM. His areas of clinical expertise include general infectious diseases, HIV and AIDS, tuberculosis and NTM infections, and Lyme disease. Prior to joining Johns Hopkins, Dr. Lippincott practiced medicine with Médecins Sans Frontières and with Right to Care South Africa. Dr. Cohen and Dr. Lippincott, thank you for joining us today.
Thanks. It's a pleasure to be here and connect with patients through this Facebook event.
Thank you. It's great to be here and to meet some of the NTM community.
We're also joined by a patient of Dr. Cohen's and Dr. Lippincott's at Johns Hopkins, Anita. Why don't you tell us a little more about yourself and your patient journey?
Okay. Hi, I'm 66 years old. In 2018, I had a cough and was really tired. The doctor said I had pneumonia. It took meds, but I still had the coughing and the tiredness. So in 2019, my doctor sent me to a pulmonologist, and they said that I had organizing pneumonia and put me on steroids. Well, that June, I had a bronchoscopy because I wasn't getting any better. And they said that I had a rapid growing NTM. When they told me that, it was so upsetting because I was never sick, never heard of it, didn't know what was going to happen to me. So they were sending me to a major center, and that's where I met Dr. Lippincott and Dr. Cohen, who knew everything about NTM, told me everything that was going to happen to me, answered all my questions, and they told me that it would be an intense treatment and a long journey to recovery. So I want to thank Dr. Lippincott and Dr. Cohen.
Thank you for sharing your story with us. Dr. Cohen, Dr. Lippincott, I'd like to get your thoughts on this. This is a story we hear so often from patients about their journey, how long it took for them to get the diagnosis and how frightening it is. Dr. Cohen, why don't you tell us a little more about how you and Dr. Lippincott practice together and treat your patients?
First, Anita, thank you so much for sharing your story with us. As people listening may know, NTM infections are rare, but cases are on the rise. And so while NTM infections are still few and far between in the US, we're increasingly seeing these. Because these infections are rare, certain doctors and medical centers may have less expertise with these infections, and the management of these is quite complex. And so one thing that I would say to patients is that if you are at a center that is less familiar with these infections, it's okay to seek a second opinion at a larger institution that may have more expertise in NTM. So in our center, as you mentioned, we specialize in the care of patients with non-tuberculous mycobacterial infections and bronchiectasis. We provide multidisciplinary care. So I myself am a pulmonologist, so that's a lung doctor, and I specialize in particular about looking at imaging of the lungs, function of the lungs, culture data from the lungs, and in teaching patients how best to care for their underlying lung disease and to clean their lungs of these infections. And I'm fortunate enough to work with a team of doctors, including Dr. Lippincott.
And I'm an infectious diseases specialist. Infectious diseases specialists try to understand the microbiology, meaning the organisms that are in the lungs, in order to determine what the best treatment might be. But whether it's a pulmonologist like Dr. Cohen or an infectious diseases specialist like myself, it's important that your doctor understand and follow the NTM treatment guidelines. Both infectious diseases specialists and pulmonologists are trained in internal medicine, and so both are qualified to take care of these types of infections. But we do have some different training, and so the combination of these two specialties allows us to provide a more holistic approach to these complex infections. The other thing that's important to know is that while we do see many NTM infections, it's not always just an NTM infection that's at play. There are often other organisms that may be contributing to a patient's issue, and we try to understand that as well.
Yeah, so to add to what Dr. Lippincott said, in order to take the best care of patients with NTM, it's not just about deciding exactly which antibiotics to treat a patient with. And to choose the antibiotics, we use the recently updated 2020 NTM guidelines. But in addition to antibiotic selection, we also want to take comprehensive care of the patient with these infections. In our center for patients who have structural lung damage as one of their risk factors for NTM infection, we teach patients airway clearance, which are maneuvers and processes to clean the lungs of bacteria. For this, in addition to Dr. Lippincott, who's an infectious disease specialist, and myself as a pulmonologist, we use a team of professionals who are physical therapists or respiratory therapists who specialize in airway clearance techniques. So for patients, it's important to know that it's not just the correct antibiotics, but also other management strategies such as airway clearance or management of the underlying lung disease that are important. So even if you're at a patient who's at a smaller practice, it's okay to ask your doctors and your medical team for a referral for airway clearance specialists who may help you best control the disease in your lungs.
Thank you. You've mentioned other services and specialties to help manage the care. Can you give us an overview of some of the other specialties that doctors should think about and that patients should be thinking about asking for?
Sure. Absolutely. So every patient's different, every patient's unique, and they have unique needs. So not every patient needs all of the bells and whistles of different subspecialty or interdisciplinary care. But in our team, some of our most common referrals are to a nutritionist to help with improving diet and weight gain, because we know for NTM infection that low weight, low body mass index is associated with worse treatment outcomes. We also frequently make referrals to mental health professionals should that be impacting people's care, because the burden of managing a chronic disease day in and day out can take a significant mental toll on people. And then lastly, we work very closely with our chest radiology team, who are experts and looking at subtle differences in chest imaging over time.
One of the other things that's important for us in the care of our patients is to make sure that we understand all of their data in its entirety. And what that means is that we need to see this information for ourselves. So we can't rely on hearsay or what someone thinks they may have had or what a doctor may have said, but rather to see all of the data ourselves. We also rely on the care of experts in other fields to help support the holistic care of our patients. That includes seeing ear, nose, and throat specialists for many of our patients who have complex sinus issues that are contributing to their lung infections. We also seek out the care from allergy and immunology specialists. These are doctors who can evaluate the immune system. Some of our patients have immune system issues. as well as patients who may have antibiotic allergies to medications that we need to utilize. We have excellent pharmacy support. This is critical because many of our patients are on medications or devices that require counseling and education in order to utilize properly. Audiologists and ophthalmologists are important specialists that we rely upon in order to monitor our patients for important side effects to some medications. We also need to see our patients regularly in the course of their care to ensure that they're doing well and that they're not having any issues with their medication, that they're having the response that we expect, and that their treatment plan is going as we would like it to. So it's not unusual for us to see patients sometimes once a month until we see improvement. Other doctors may not follow that exact schedule, but it is important that patients with these types of infections are monitored frequently to ensure that they're doing well.
Thank you very much, Dr. Lippincott. We appreciate the insight that you and Dr. Cohen have given us. Anita, I want to go back to your experience as a patient for a moment. What advice do you give patients? Would you give patients to manage their care?
I think it's great if you go to a major center, because there you can go one place, have all your tests done, test, blood, everything, which makes it so much easier on you. And, one thing about your doctor, my doctor sent me to other doctors to check me out for all the different side effects, which makes it better. And, just make sure you have doctors that you feel confident in and you trust. And that makes a world of difference. And, when you have doctors like that, no matter how minute or how small a question that you're even thinking, ask them. That's important. Whatever you're feeling, you ask them doctors that. And another thing that's good, when you go to your doctors or whatever center or wherever you go, make sure you have copies of all your records, your scans, your tests, and keep them for you and your doctors so that they can look and see everything. If you went to another doctor, what they're saying is, it's important for you to feel confident with your doctors, and that, because they know what your condition is, what's going to happen to you. That makes a world of difference. And I was lucky because the treatment they gave me was great. I mean, even the people that I got my medicines to, they shipped me medicines to my family when we were away at my family's house. So I was very lucky. But the biggest luck of all was that I had Dr. Lippincott and Dr. Cohen and Megan and my family that were supporting me and kept me healthy. And now I'm at the end of my journey, and I just want to thank them so much.
Anita, thank you so much for sharing that with us. Thank you for sharing your story. And thank you, Dr. Cohen, Dr. Lippincott, for being with us today. So we're going to take questions now. So you can type your questions into the comments box below, and our experts will take your questions. Thank you.